Hello, my name is Christina Walker, and I would like to welcome you all to the Center for Law and Social Policy's webinar on our recently released brief entitled Disparate Access, Head Start and CCDBG Data by Race and Ethnicity. For those of you who are not familiar with the Center for Law and Social Policy, or CLASP, we are a nonprofit anti-poverty organization that advocates for public policies that reduce poverty, improve the lives of poor people, and create ladders to economic security for all, regardless of race, gender, or geography. We target large-scale opportunities to reform federal and state programs, funding, and service systems, then work on the ground for effective implementation. Before we begin, I would like to quickly mention some housekeeping items regarding what you can expect over the duration of the webinar, which will be 1 hour. As you join the webinar, your phone lines are automatically muted and will remain muted. We will save time at the end of the webinar to take some questions from the audience. To submit questions, please send them in via the chat box. You can also let us know about technical issues you're experiencing through the chat box. And please note that the presentation and recording will be available after the webinar on our website, clasp.org. Next slide, please. In today's webinar, we'll be discussing the findings from our Disparate Access brief regarding children's access to Head Start Preschool, Early Head Start, and Child Care and Development Block Grant, or CCDBG, as well as have a discussion on how to understand the data. You can access the full report as well as the state-by-state findings and our methodology at the link on the screen. Next slide, please. So here's an overview of our webinar today. I will be starting with an introduction to who the young children are, including some data on race, ethnicity, and poverty. Next, I will provide an overview of the Head Start Preschool and Early Head Start findings from the report. Stephanie Schmidt, Senior Policy Analyst on the Child Care and Early Education team and the co-author of the Disparate Access report, will present on the CCDBG findings. Then we will hear from our 2 state panelists. We are extremely grateful they were able to join us today. First, we will hear from Giannina Perez, who is the Senior Director for Early Childhood Policy at Children Now in California. Children Now is a leading nonpartisan national, state, and local research, policy development, and advocacy organization dedicated to improving children's overall well-being. Giannina will discuss how she and her colleagues understand this data within their state's context and how they can use it to inform their advocacy and policy development. Then we will hear from Carol Burnett, the founder and executive director of Mississippi Low Income Child Care Initiative, an organization working to improve the quality, advocate for investments, and build grassroots support for a statewide network of early childhood education and development providers. Carol will discuss how important it is to consider who is served in a program and how policy implementation can impact communities of color. Thank you again to both of you for being with us today. And then again, we plan to leave some time at the end for questions, so please remember to send us your questions via the chat box. Next slide. So now we'll turn to take a look at the data from the report. First, we'll take a look at some data on the diversity of the young children in the United States. Next slide. Young children in the U.S. are, as a group, diverse in race and ethnicity. Children born in recent years have been majority minority, as racial and ethnic minorities now make up half of the young child population, with young children defined as birth through age 5. It is estimated that the tipping point to a majority minority population for all children under the age of 18 will happen in less than 5 years. An analysis of census data shows that 50% of young children were white, non-Hispanic, or Latino, and 14% were African American or Black, non-Hispanic, or Latino. 1/4, or 26%, were Hispanic or Latino regardless of their race. Finally, 4% were Asian and 1% were American Indian and Alaska Native. Next slide. It's also important to note that young children are most likely of any age group to be poor, which research shows is a strong predictor of children's success in school and of adult employment and earnings. In 2014, 24% of young children were poor, or families living in families at or below 100% of the federal poverty level. These data also show that a disproportionate number of young minority children are poor. Black children experience the highest poverty rate of any race or ethnic group at 43%, followed closely by American Indian and Alaska Native children at 40%. Hispanic or Latino children also experience high poverty rates at 34%. While children growing up in poverty experience poorer health, higher incidence of developmental delays and learning disabilities, and greater hunger compared to their peers, high-quality early care and education programs can play a critical role in the healthy development of young children, particularly those from low-income households. With children of color being overrepresented amongst poor children, it's important to look at the level of access that these young children of color have to early childhood care and education opportunities. Next slide, please. So now that we're grounded in some of the data on young children more generally, we'll turn to the methodologies and findings from our report. Our brief offers state-by-state estimates of racial and ethnic differences in the share of eligible children who participate in Head Start Preschool, Early Head Start, and CCDBG. I'll first be focusing on the Head Start findings. Please note that we calculated participation rates by comparing the number of children in Head Start or CCDBG to the number of eligible children based on administrative data and data from the American Community Survey. The findings are based on 3 years of data from 2011 to 2013. I also want to mention that this brief looks only at Black, Hispanic or Latino, Asian, and American Indian Alaska Native populations due to limitations in the data. Because the Head Start and CCDBG administrative data report race and ethnicity separately, it is not possible to identify which children were white, non-Hispanic, or Latino. Therefore, white children were not included in this analysis. Further, because of sample size issues, some race categories had too few children to analyze in particular states. Next slide. So in order to best understand the data that we're about to present, it's important to understand the context in which Head Start programs are administered, as well as the eligibility parameters for the programs. As many of you know, Head Start programs are administered through a federal to local grantee funding stream, except for in the instances that a few states are themselves early Head Start grantees. Therefore, assessing the data on participation in Head Start in each state is not an indicator of state policy choices, but more provides a state-by-state look at federal investments. In this report, we looked specifically at access to early Head Start and the Head Start preschool programs. Early Head Start serves children birth through age 2, and Head Start preschool serves children ages 3 and 4. Early Head Start also serves pregnant women, but this report is limited to the data on children. Head Start eligibility is based on poverty status. Therefore, eligibility in this analysis was limited to young children living in households below the federal poverty level. And because we modeled eligibility based solely on the poverty level, these findings should be considered estimates and not exact. Programs are also allowed to enroll children above the poverty level and for categorical eligibility reasons. Our analysis does not include data on children served in the migrant and seasonal programs or the American Indian Alaska Native programs due to the complex eligibility criteria for both of these programs. Next slide. It's also important to know that the overall makeup of Head Start programs is diverse. 38% of all Head Start children are Hispanic, regardless of their race. 29% are African American or Black. Almost 1 in 10 children identify as biracial or multiracial, and 12% identify as an unspecified or other race. And while 43% of children were white, again, it is important to remember that it is not possible to identify white, non-Hispanic, or Latino children from the white Hispanic or Latino children due to the way the data was collected. Next slide. And now to the findings from the report. Fewer than half of all eligible children, those with incomes under the federal poverty level, were served in Head Start preschool nationally. About 54% of eligible Black preschoolers were served in Head Start preschool, as were 38% of eligible Hispanic or Latino children, and 36% of eligible Asian children. Please note that additional children birth to age 5 were also receiving migrant and seasonal Head Start services, and the vast majority of these children are Hispanic or Latino. Therefore, a greater share of poor Latino children have access to Head Start services than is shown here, and that would narrow the gap in access between Black and Latino children. Next slide. At the state level, the differences in access to the Head Start preschool program are striking. For Black preschoolers, the share of eligible children served ranges from 28% in Arizona to 108% in Mississippi. It's also important to note that because our pool of potentially eligible children is based solely on income and does not include children who may be categorically eligible or account for the share of children above the poverty level, some percentages in this analysis are greater than 100. For Hispanic and Latino preschoolers, the share of eligible children served ranges from 13% in South Carolina to 84% in Minnesota. The majority of states had too few eligible Asian children to calculate the percentage served. However, the share of eligible Asian children served in the 4 states included in the analysis ranges from 11% in Texas to 41% in California. To see the state-by-state percentages for all children and each race and ethnicity, please consult Appendix 2 of the Disparate Access brief. Next slide, please. So when we look at the state-by-state percentages of eligible Black children served by Head Start Preschool, we can visualize some interesting trends when we look at a map. So please note on the map that the states with the color white had too few eligible Black children to calculate estimates, so that left 34 states with the District of Columbia with percentages of access. As we saw on the past slide, the overall percentage of eligible Black children served through Head Start Preschool has a wide range, but overall it is higher than the national average for all children or for children of other races and ethnicities. As seen on the map, there are regional pockets of higher than average access for states in the South and in the Great Lakes Midwest region. As we mentioned in the brief, access to services for particular populations can be improved when there is a commitment and a dedication of resources. One hypothesis for high access for Black children for Head Start Preschool, particularly in states like Mississippi and Louisiana, is likely due to Head Start's initial grounding in the civil rights movement in the South. Next slide, please. Turning now to early Head Start findings, according to our analysis, just 5% of eligible children were served in the early Head Start program nationally. The percentages of eligible children served were low across the board for all races and ethnicities. 6% of Black infants and toddlers, 5% of Hispanic or Latino infants and toddlers, and 4% of Asian infants and toddlers. As with Head Start Preschool, there are differences across states in the share of children served by race and ethnicity in early Head Start. However, the main takeaway for early Head Start is that access, regardless of race and ethnicity, is universally low. 6 states served only 4%, the lowest percentage across all states of the eligible Black infants and toddlers: Arizona, Indiana, Michigan, New Jersey, Tennessee, and Texas. Georgia and Louisiana served the smallest percentage of eligible Hispanic Latino infants and toddlers at just 1%. Georgia served fewer than 1% of the eligible Asian infant and toddler population, and New Jersey served only 1%. And again, to see the state-by-state percentages for all children and each race and ethnicity for early Head Start, please consult Appendix 3 of the Disparate Access brief. Next slide, please. So before I turn the presentation over to my colleague Stephanie, I'd just like to remind the audience that we're saving time at the end for questions, so please submit them via the chat box. And now over to Stephanie.
Thank you, Christina. Next slide. As Christina mentioned earlier, in order to best understand the data we're presenting today, it's important to understand the context in which the programs, in this instance CCDBG, are administered, as well as the eligibility parameters for the program. CCDBG is the largest source of federal funding for childcare in the country. Unlike Head Start, CCDBG's funding structure is federal to state, meaning that the dollars allocated for the program travel from the federal government to the state. The state then administers the program by designing the policies that the programs must follow within the federal parameters of the law. States have significant discretion in creating these policies, and they vary by state. One of those policies is eligibility. States can set the income eligibility limit at whatever they wish, so long as it is below the federal parameter of 85% of state median income. Many states set their eligibility far below that, and there is a significant range. For purposes of this paper, 175% of the federal poverty level was used to determine who was eligible. This was chosen as it is the median income eligibility across all states for CCDBG currently. As such, the percentages of access you will see in the slides following this actually understate the need for child care assistance among all children that could be eligible according to the federal parameters. Another policy that states have discretion over is the work and education requirements that parents must meet to be receiving subsidy for their children. For purposes of this paper, and because of data limitations, only work requirements were considered. In order to be considered eligible, in addition to the income parameters outlined for purposes of this analysis, both parents in a two-parent family must be working, or the only parent in a single-parent family must be working. Our analysis looked at CCDBG-funded childcare only. This means that children receiving childcare that is funded directly through the TANF program, or Temporary Assistance for Needy Families, are not included in this analysis. In 2014, 1.4 million children were served through CCDBG funds alone. Next slide. So let's take a quick look at the racial and ethnic makeup of those 1.4 million children who were being served in CCDBG in 2014. 21% of all children served in CCDBG, regardless of race, were Hispanic or Latino. 42% of those children that are being served were African American or Black. And while 41% were white, it's not possible to identify white non-Hispanic or Latino children from the white Hispanic or Latino children due to the way the data was collected. Next slide. According to CLASP analysis, 13% of eligible children were served in CCDBG nationally based on income eligibility at 175% of poverty and the working status of parents. Access for most racial and ethnic groups is low across the board, ranging from 6% to 21% of eligible children being served. Nationally, CCDBG served 21% of eligible Black children, 11% of eligible Asian children, 8% of eligible Hispanic or Latino children, and 6% of eligible American Indian Alaska Native children. You will see that for all groups besides Black, the share of children served is below the national average. Additionally, the share of Hispanic Latino children and American Indian Alaska Native children served is nearly half that of all children and 1/3 of the percent of Black children served in CCDBG. Next slide. For CCDBG, there are considerable differences by state in the share of eligible children served by race and ethnicity. For Black children, the share served by CCDBG ranges from 3% in Maine to 42% in Pennsylvania. For Hispanic or Latino children, the share ranges from 1% in Mississippi to 20% in New Jersey. For American Indian Alaska Native children, less than 1% of eligible children are served in Hawaii compared to 43% in Arizona. And for Asian children, the share ranges from less than 1% in Arizona, Montana, North Dakota, and South Dakota to 73% in New York. As a reminder, to see all state access by race and ethnicity, you can visit the appendices of the full paper. CCDBG is highlighted in Appendix 4. Next slide, please. This map shows the significant variation in access, but also the very low levels for Hispanic and Latino children. The very light pink color that you see in the southeast and northwest shows pockets of incredibly disparate access with ranges from 0 to 5% in these states. The slightly darker pink that you see on the largest proportion of states shows access on par with the national average of 8%, with access ranging from 5 to 10% in these states. The very darkest red color that you see in the northeast, New Mexico, and Alaska indicates states with the highest access, but even the highest access only ranges from 15 to 20%. 29 states of the 47 that we were able to calculate had access below the national average of 8%. Next slide. And now that we've presented the data points, I want to take just a few moments to talk about the potential reasons that access to both Head Start and CCDBG is low and disparate for children across the country. Next slide. While this analysis alone cannot determine causation for disparate rates of access, we can offer some possible explanations and hypotheses. Federal funding has not kept pace with changing demographics. Over time, where low-income young children live has changed geographically, yet historic patterns of funding have not kept pace with demographic shifts. The data suggests that relatively flat funding has particularly restricted access in states with a growing population of young children for particular racial and ethnic groups. Notably, states in the South and Southwest have experienced rapid growth in their child populations in the past decade, particularly among Hispanic or Latino children, and in some states, Black children. Additionally, new investments have been particularly limited. For example, CCDBG is serving the fewest children in the last 16 years. Access to Head Start, and even more strikingly, CCDBG, is low in a number of fast-growing southern states for Black children, Hispanic or Latino children, or both. access for Hispanic or Latino children is particularly restricted overall in CCDBG. Because federal Head Start and CCDBG funding has only achieved relatively small gains in recent years, and because the funding formula reflects past state allotments, areas with new populations in need tend not to get additional resources except when there is an expansion of funding. Thus, states with growing populations of eligible children will be less able to serve them. While the federal government provides the bulk of funding for Head Start and CCDBG services, increased state investments to expand the number of children accessing Head Start services and child care assistance could also result in a higher share of eligible children served and potentially reduce disparities across groups. This analysis has also shown us that targeted programs to increase access for specific populations can work. Access to early childhood services for particular populations can be improved when there is a commitment and dedication of resources. From its inception, Head Start has worked to ensure access to groups of especially vulnerable children. Examples include Head Start's initial grounding in the civil rights movement in the South, reflected in high access for Black children in slower-growing southern states such as Mississippi and Louisiana. The Migrant Program, which increases Head Start's reach among Hispanic or Latino families, and the American Indian Alaska Native Program, which targets services to American Indian Alaska Native families. Eligible children served in CCDBG by race varied tremendously across states, as we reviewed just moments ago. This is likely based on a number of factors that are difficult to determine, but may reflect a great variation of state budget and policy climates, as well as a significant policy discretion that states have under CCDBG. More precise calculations could be determined by looking at state eligibility parameters individually, which may be a next step for our work. State CCDBG policies impact who accesses care. Because of a large number of state policies that impact access to subsidies, it is possible that particular groups of children are more or less likely to obtain child care assistance based on state policy choices. For example, particular state eligibility practices may make it difficult for families with highly variable hours of employment to participate. To the extent that this is a characteristic of employment patterns of Hispanic or Latino families, such policies may disproportionately impact Latino families. Limited English proficiency may serve as an additional barrier for some families, as well as state verification procedures for mixed citizenship status immigrant families where the child is a U.S. citizen eligible for CCDBG, but the parents are not citizens. New immigrant communities may be unaware of the availability of child care assistance and their eligibility for services. Next slide. And now I would like to turn it over to Giannina Perez to reflect on the findings of this paper in the context of her organization and state. Giannina?
Thank you, Christina. Next slide, please. And one more time, please. So just want to say good morning, buenos dias, or buenas tardes, good afternoon, depending on where you are right now. As Christina mentioned, my name is Giannina Perez, and I work at Children Now, a California-based research policy and advocacy organization where I lead our early childhood policy work. This includes home visiting, early identification and intervention, child care, preschool, kindergarten readiness assessments, as well as alignment with K-12. Thank you to CLASP for convening this important webinar. Next slide. What I hope to cover with you in the next 10 minutes are 6 quick things. Number 1, our key takeaways from the report. 2, some context about California. Next, what would be our primary hurdles to addressing these disparities? Areas where we want to gain more clarity, how we think we can best move forward, and some available resources. Next slide, please. So what did this report highlight for us? As many of you as well probably had a sense that there are very real disparities in your state. And for us in California, we knew that there were disparities. Our ECE funding was limited, and that babies and toddlers in particular are lacking the most access to services. What we learned from this report, where California stood compared to others, not so bad in some areas, but definitely nothing to cheer too loudly about. Below average and actually near the bottom for eligible African American kids in Head Start, slightly higher than average in regards to Latino Head Start kids, and higher for Asian Head Start kids. Our CCDBG Latino eligible kids is just way too low, similar to the national trends. In California, more than half of our kids are Latino, so this is a particularly important challenge for us. I should note for CCDBG analysis, our state median income level is actually higher than the average used, so these numbers underestimate our pool of eligible kids. The early Head Start statistics on a whole are just unacceptable. Funding doesn't line up with what the research says about the importance of birth to 3, and this is a problem across the country. To see the statistic again, about 95% of all poor infants and toddlers, regardless of race, lack access to early Head Start, really is just a reminder again about the need for us to focus on babies and toddlers. We also learned that there are challenges across the country. Some states, as we just shared, are doing quite well with some populations. Some states had very high percentages for their African American and Latino Head Start kids, for example. This national variance means we have a lot to learn from each other. And here in California, we very much would like to learn from other states. Next slide, please. So some California context. No newsflash here. California is a big state. In addition to a big state, we are a very diverse state. In California, the 0 to 5 population is more than 70% kids of color. More than 50% of our young kids are Latino. In comparison to the national data, 26% of our young children are white. Our economy is still digging out of the recession, as in many parts of the country, and our ECE investments are not where they should be. Next slide, please. Some of our biggest challenges: kids come from families with lots of types of diversity. Most kids are citizens, and half come from families where at least one parent is an immigrant. There's also immigrant diversity that I think sometimes goes unrecognized. A family may be from Mexico, for example, and they could speak Spanish, or they could speak a variation of Mixtec or another indigenous language. This can present a number of barriers. How best to outreach? How does a teacher work with dual language learner kids when her classroom could be filled with more than a dozen languages? Our economy, our cost of living is a challenge, and of course the fact that wages have not been increasing is a major challenge for many of our families. Our ECE investments, we have very little governor support, unfortunately, but very strong legislative support. Our funding, especially reimbursement rates, are insufficient, and like many parts of the country, our ECE workforce themselves are many times living in poverty because of the low wages they earn. So not surprising, the quality is also a challenge for us. Next slide, please. So taking the CLASP report in our situation, it is clear that we need to get some more information and think further about how best to move forward. We definitely want to dig into the data more. Are there further disparities? We want to know how eligible white kids are faring, and how best to do that given the restraints that CLASP flagged with the data. We also need data to help us distinguish access for immigrant families within Black, Latino, and Asian populations. Not all immigrant families face the same challenges. In many communities in California, for example, there are lots of resources available in Spanish, and in some areas Mandarin, Vietnamese, and Hmong, but less, if any, for some languages. Asian is also such a broad category that we want to know more about specific Asian populations too. We are also very interested in learning more about Head Start. Their disparities as a whole were less compared to CCDBG. So we want to learn, why is that? Is it because they are a well-established program, their comprehensive nature, their active parent councils, or the fact that many times their staff often reflect the community that they serve? We want to know more about the actual settings. So is the home-based option in early Head Start, for example, more successful with immigrant families or less successful? Turning to assessing our barriers, we know that one big barrier is insufficient funding all around for subsidized slots, especially for infants and toddlers. And as a result, our overall access and affordability present big challenges for families. There are specific distinct community and family needs too. In addition to the unique needs of immigrants or refugees who may need immediate physical and mental health support, there are changes happening in neighborhoods. Gentrification is a big challenge for many parts of our state. In addition to that, though, we have some real access needs for rural families, and we hear time and time again that transportation is a big challenge. There are also very real linguistic and cultural needs that we need to address, from improving provider sensitivities to new cultures in their service area, or to distress the government institutions among undocumented and mixed status immigrant families, which can deter them from feeling safe to enroll their children in a program. Next slide, please. So, how can we address some of these barriers and move forward? We will definitely keep the bullhorn blaring about the need for increased ECE investment. We do have a movement happening in our state for universal pre-K for 4-year-olds, and it is gaining traction. We also want to keep the spotlight shining on the need for targeting access for low-income birth to 3 children. As this report clearly helped highlight, we really do need to focus on increasing funding for our youngest. We also will keep pushing for family-friendly policies, many of which are part of the CCDBG reauthorization. For example, for us, increasing our state median income is important so families don't fall off once they do get on their feet. Another big issue is continuous 12-month eligibility, as well as reducing paperwork and streamlining enrollment to save both provider and family time and headaches. We think many of these family-friendly policies will go a long way to serving all families and will also be especially helpful to families of color. We also know that there needs to be greater options. There needs to be more full day, and there needs to be more off-hour. Our economy is becoming more and more what's called a gig economy, so folks who work odd hours, who work multiple jobs, piecing an income together really need to have the support for their families. Of course, provider training is something that is important too. Providers need support in how best to work with diverse families, including new Americans immigrating from other countries. This includes, in addition to improving outreach and how best to work with dual language learners, training on true family engagement and partnership. And I also want to point out just having safe spaces to talk about race and culture. There is research showing that we all have unconscious biases, and we should have opportunities to be open about that and learn from each other. Next slide, please. Some additional thoughts on how we hope to carry this work forward. For us, we really want to think about how best to share this data with decision makers who we know care about equality, but actually they themselves may not be ECE champions. How can we get them involved in this? Likewise, which of our pro-ECE legislators need to hear about this too, so they are using it when they're advocating with their colleagues? This data will definitely be shared at upcoming related budget hearings too. I do also echo the CLASP recommendation of engaging new non-ECE partners from immigrant and civil rights communities to learn more about barriers and potential strategies. In addition to those communities, I would also include learning from health providers, housing authorities, and churches on how they actively engage and serve diverse communities, since they themselves have been very embedded in these communities. Obviously, parents themselves can very simply tell us why it is a challenge. We have heard from families that there are definite language barriers. They prefer to have young children with their relatives. They want the family provider or center provider to speak their language. They don't think they can afford the care. There are no spaces near them, and transportation is a challenge. This CLASP report has helped shine a light on an important issue, and Children Now is committed to continue working on policies to improve access for all families, as well as improving our state's number for kids of color. We will keep learning what other states are doing, likewise learning how local communities in California are successfully serving families, how they outreach and engage, but also how they provide ongoing support and build trust so that diverse families feel connected and stay in their programs. We know that turnover is a challenge, not just for staff, but also for families. So how best are programs dealing with those situations. We want to also learn more about successful provider training and model. Next slide, please. So here are some resources. The first two are actual very new resources. One that specializes on immigrant access to ECE and highlights the very real challenges in the Silicon Valley, which many think, their income is very, very high, but there are real pockets of poverty, and their immigrant families are facing additional barriers to accessing ECE. The second resource highlights what is happening in Los Angeles County with family engagement efforts. And then the final two are some resources from Children Now. My information is also available, and I truly do hope that we can stay in touch because we have a lot to learn from how other states are doing better to address their disparities. Thank you. Gracias.
Thank you so much, Giannina. And now we'll turn it over to Carol Burnett from the Mississippi Low-Income Child Care Initiative.
Thank you so much, and good afternoon, everyone. I am going to share, can we have the slides? Thank you. I'm going to share information that came from a recent report that was issued by the U.S. Commission on Civil Rights, taking a look at the impact of race on Mississippi's operation of the child care program. Next slide. As Christina said, we are a nonprofit organization working to strengthen Mississippi's child care delivery system for services to low-income working families. Our work consistently reveals to us the adverse impact of race on Mississippi's child care delivery system and those who rely on it. Next slide. The U.S. Commission on Civil Rights issued a report that shows serious harmful impacts on Mississippi's low-income working families of color in the way our state operates the federal CCDF program. The report identifies budget decisions that divert federal child care funds and fail to use all the available funds for child care services while large numbers of eligible children remain unserved. The report highlights policy decisions that obstruct parental access to service, and it focuses on the financial impact of our state's quality rating system as it prices out providers in low-income communities of color who are attempting to serve parents who can ill afford expensive child care fees. Our organization provided testimony leading to the Civil Rights Commission report. We reported not only our research, but also the widespread experience of our constituents who rely on the child care subsidy program. Next slide, please. Those that are on the child care program in Mississippi right now are 92% Black. Next slide, please. The report notes the Mississippi context for child care services to show the population that's eligible and the disparities that exist in order to show how policy and budget decisions exacerbate those disparities. This slide shows our state's well-known and intractably high child poverty rate statewide. The racial disparity is made transparent when you note that the child poverty rate for Black children in our state is 51% compared to that for white children at 16%. Next slide, please. Half of our state's children live in families headed by single mothers. Poverty is concentrated in these families. 66% of low-income children at the income eligibility for the federal child care subsidy program live in families that are headed by single moms, and these families work. Next slide, please. But work holds gender inequities that thwart single moms' efforts to provide for their families. While you see women make up half of our state's workforce, women make up 72% of our state's minimum wage workers. And what we know about minimum wage is that it leaves a family of two, a mom and a child, below the federal poverty level. Next slide, please. And For these low-income working families, child care subsidies make a huge positive difference. They make child care affordable. As noted on this slide, the federal CCDF child care subsidy can reduce child care costs for a single mom with children quite dramatically. Next slide. Yet the child care subsidy program serves only a fraction of our state's eligible children. Even when you add Head Start, Early Head Start, and pre-K, you see that we leave about 2/3 of our state's eligible children without service to any of these programs. And it's really not quite useful to include Head Start and pre-K because in our state those programs still operate only 6 hours a day and they're closed in the summer, so they're not always a good child care solution for a working family. Next slide, please. So the Civil Rights Commission report cited budget decisions in Mississippi that the report says have a significant disparate impact primarily on African American families. So while there is this large unmet need, and in fact there's also a large waiting list, nearly 14,000 children, the report noted that the state has done a few things. One, the state lead agency diverted millions to a contract to Xerox for fingerprinting to try to detect fraud. And the report notes that the agency also indicated that they had no evidence that fraud was being committed. The report notes that the state reports to HHS on their annual TANF grants, and the reports that go to HHS indicate large unspent balances in the state's TANF welfare grant that could be used to expand the number of eligible children in the child care program. The state lead agency also diverts millions away from services to children to finance non-direct services, including a quality rating system that is shown to be so expensive that it prices out centers that are located in low-income communities of color. Next slide, please. And the number of children in the state being served by the child care program have shrunk. This slide shows numbers. The report indicated showing that the number served has shrunk by 46% since 2010, and that's a time period when the federal funding for the program only shrunk by 28%. And we have recently heard our state lead agency report to our state legislature that they plan to shrink the numbers of children served by another half because of investments they're going to make in the quality rating system that they're claiming are mandated by the new federal child care regulations. Next slide, please. So just to show the quality rating system is a system that low-income child care centers can afford to succeed in. This slide shows the blue base rate for reimbursement in the federal child care program in Mississippi. The red shows the quality bonus that centers get for achieving higher levels of quality at each star level in the quality rating system. And the gray shows how far away those are from achieving 100% of Mississippi's market rate for child care. So it just demonstrates that even at the highest star 5 level, centers still haven't gotten a high enough reimbursement rate for services to even get to 100% of the market rate for child care. My organization did a study on the quality rating system showing that the costs related to participation and success and moving up star rankings cost about $10,000 per classroom, driven primarily by the environmental rating scales used in the quality rating system. So all of this information was addressed in the report to demonstrate that the costs are so expensive that it has the effect of pricing out low-income centers. Next slide, please. These figures came from the state of Mississippi's report to HHS on our annual TANF grant, and they just represent the large unspent balances at the end of each year that could be used to finance child care services to eligible children. And these numbers were included in the Civil Rights Commission report. Next slide, please. The report also cited policy choices that Mississippi has made that unduly restrict or limit child care participation and have a disparate impact on African American families. One of the eligibility criteria that is targeted at single parents, who are virtually all in Mississippi single mothers, the report noted actually has a disparate impact on women. And that is the requirement that single parents enact legal action to get child support from the absent parent before they can qualify to get child care assistance. And that child support requirement, the report notes, has a disparate impact on women. The other policy has to do with the redetermination requirements and interim reporting requirements. The state has 1 year eligibility for child care assistance, but when you look at how that plays out, given all the interim reporting requirements, families actually only receive somewhere between 13 days and 260 days a year of service because of how those interim reporting requirements result in disruptions in service. Next slide, please. The report cites a climate of distrust among providers. It cites a lack of transparency and a lack of sharing accurate and comprehensive data on the part of the lead agency. Next slide, please. And the findings are that our state policies regarding child care restrict families in greatest need from accessing care. The budget decisions divert already inadequate funding away from and fail to use funding available to serve eligible children. That our quality rating system is unaffordable, and in fact there were examples of rater bias, and the mistrust and lack of cooperation in how the lead agency interacts with providers on the program, and that these factors actually impede the goals of the program. Next slide, please. So finally, the findings are that in this child care subsidy program, lead agencies should eliminate the child support requirement. States should be required to spend quality money to help low-income centers meet quality improvement standards so they aren't priced out. States should be required to use quality rating system standards that are culturally relevant to all populations. Quality rating system policy should clarify what the procedures are so that rater bias can be eliminated. Lead agencies should respond to public input and should report accurate data to the public. Next slide, please. So where we are now, the report has come out. The U.S. Commission on Civil Rights has written a letter to the HHS Office for Child Care, urging them to adopt the recommendations that were in the report. That letter went to HHS, and the recommendations were urged to be adopted by the Federal Office of Child Care. We in Mississippi have advocated the adoption of these recommendations here at our lead agency, the Mississippi Department of Human Services, particularly as we are involved in the process now of writing our new state plan in the Child Care Development Fund to comply with new federal rules. At present, the state plan draft has failed to incorporate any of these recommendations. So we're continuing to try to find ways to have these recommendations be adopted. And as I mentioned, our state is now saying that they intend to invest such a large amount in the quality rating system going forward, it's going to require a gutting of services to children by another half. And the state is saying that those are moves required by the new federal regulations, which is not the case. This slide has a site where you can go to get a full copy of the Civil Rights Commission report if you would like that, and it's got my contact information if you would like to follow up with any questions. Thank you.
And thank you, Carol, for sharing that incredibly interesting and useful information with us. It's a great segue into a conversation about the next steps. As a reminder, please submit any questions that you have via the chat box. We'll be getting to questions very, very soon. The findings of the Disparate Access paper and the presentations you heard today from Giannina and Carol are meant to start a conversation about what can be done next to learn more, specifically on the state level, and to start to take action. Data findings in this paper suggest a number of potential next steps to improve available data, better understand the causes of differential access, and ultimately improve access to childcare and early education for children regardless of race or ethnicity. While the data cannot reveal precisely why differences in access exist, they can help inform further exploration, research, and advocacy to identify barriers to access and solutions for underserved groups. A first next step is greater investment at all levels of government. Additional investments are crucial to reducing barriers to access for racial and ethnic minorities. As outlined earlier, current federal and state investments severely limit access to high-quality childcare and early education for many children. And for some groups of children in particular states, access is extremely limited. Flat funding or minimal increases perpetuate inequities, as there's no way to increase access for one group without reducing access for another. Improved data collection and reporting on both access and the quality of programs would inform our understanding of how diverse groups of children experience differential access to Head Start and CCDBG. For example, current CCDBG and Head Start administrative data reporting should be strengthened to be consistent with the government's overall standards for reporting on race and ethnicity, so that cross-tabulation of white and Black children by Hispanic, Latino, or non-Hispanic or Latino ethnicity would allow for comparisons of access across all racial and ethnic groups. Some improvements to data reporting in both Head Start and CCDBG are coming. In the 2015 Head Start Program Information Report data, race and ethnicity will be reported together for the first time, which will allow for more accurate understanding of the racial and ethnic makeup of the program. The 2015 CCDBG administrative data reporting will include quality information, and the 2017 data will include the primary language spoken in a child's home. Also, states often have better data than what is reported to the Office of Child Care or Office of Head Start. So thinking about what you have in your state and how you can use that to paint the picture or start conversations is a good first step. In CCDBG, states play a large role in determining who gets access to subsidies and the quality of child care that can be accessed. Take, for example, the redetermination and child support policies that Carol just discussed as restricting the families in greatest need as determined in the findings of the case that Carol discussed. Taking a closer look at patterns of state policy and funding choices within the child care subsidy program to identify state-level policies that restrict or expand access for children is necessary to further understand the disparities that result. While not all services should necessarily be targeted, intentionally reaching underserved populations may be a successful strategy that emerges from Head Start's history of targeting resources. In CCDBG, states can consider the use of contracted slots for child care services in particular communities to increase access for underserved populations. And as Giannina already outlined, it is important for early care and education stakeholders to build relationships and partner with organizations that serve and represent racial, ethnic, and immigrant families. The early childhood, civil rights, and immigrant rights communities often operate independently of one another. Formal and informal collaborations can take many forms and may include convenings, trainings on issues of importance to both communities, and seeking input from one another on the overlap between the racial, ethnic, and linguistic composition of young children and the services and programs available to them. Convenings offer an important opportunity for stakeholders to share knowledge, garner new ideas, and discuss how data can be used as a tool for addressing racial inequities. And with that, I'll turn it back over to Christina to facilitate the questions and answers.
Thanks, Stephanie, and thank you to Carol and Giannina as well. And now that we have had an overview of some potential next steps we can take in order to better understand the causes of differential access, as well as to advocate for improved access to childcare and early education opportunities for all children, we'd like to take these last few minutes for questions. Sorry, we don't have a lot of time, but we will try to loop back with everyone once we are able to get the information after the webinar. So we'll try to loop back with you if we didn't get to your question today. And we also have our contact information on the next slide, if you can progress to the next slide, so that you can follow up with us after the webinar as well. So now for the first question, this one is to Giannina. How can the lessons learned in California be translated to other states, or what are other suggestions that you have for other states in order to take action forward?
Thank you. So I think it really is about coming together, with your partners, your other ECE partners, and then the non-ECE, if you do have any relations with them, and just digging into the data. I mean, for us, we really got affirmation about hunches that we already knew, but we really needed reports like this to highlight and to bubble up these issues of disparities. We are a nonpartisan, all kids organization, but for us, it really helped galvanize, like, we need to focus in on these disparities. So I would just encourage you, given as an advocate organization, you already have, I assume, a strong base to pull from. Just really dig in. For us, I did point out too that our family-friendly policies have just bubbled up for all families, and so we know that will actually help those barriers too. So what is your state median income? What are the specific challenges that are happening with paperwork? We're hearing paperwork a lot. We're hearing the 12-month eligibility are challenges for us in our state. So perhaps pulling out those barriers that all families are facing, and then digging into how could particular racial and ethnic families be, even more compounded by that.
Great, thank you so much, Giannina. And this next question is for Carol. How best can we incentivize QRIS participation for low-income families? We don't want to just focus on access.
Well, the report suggests that adequate resources be provided to those centers serving low-income working families so that the cost of participation doesn't create a barrier to their participation. So that's one thing that we need to do here in Mississippi, to direct grants to centers where the population being served are low-income families who can't pay a higher fee to fill the gap between what it costs to participate and what the subsidy program will pay in reimbursement. The other thing that we're doing in Mississippi is reviewing whether the criteria in the quality rating system are the right criteria, because it may be that there are criteria that are not as expensive, like the environmental rating scale scoring system, or that the investments that are made, for example, right now there's a scholarship program in our state to help teachers get higher levels of education, but our state has failed to invest in stipends for wages to keep those educated workers in the child care sector. Without the wage supplement, those workers leave child care to go work for Head Start or public schools or other sectors that have the funds to pay higher wages. So there are strategies that can target resources to those places with the greatest financial need that want to participate, that help them be able to participate because they have the financial resources to do so. The point is to try to create a system for quality improvement that doesn't price the poorest centers out.
Great. Thank you so much, Carol, for taking that question on. So next we have a quick methodological question that I'll direct to Stephanie because it's regarding the CCDBG data. We selected 175% of federal poverty level for the income eligibility level for our analysis. So this question is, why didn't you choose the state-by-state income eligibility criteria?
Great, so that's a good question. The reason we didn't choose the state income eligibility criteria is because we know that in practice, states set income eligibility far below this level. And so if we use the state income parameters, it would significantly underestimate the share of low-income children with working parents who need help paying for childcare but are restricted by states from getting any help. And alternatively, if we use the federal income parameters, we would have a much larger pool of eligible children, and that would mask the differences across race and ethnicity because many fewer eligible children would be served across all the groups. And so we chose 175% of poverty because it's the median state income eligibility in the data year that we used, 2014, and we used it sort of as a midpoint in between the state eligibility and the federal eligibility to sort of get to a place where we wouldn't be exacerbating on either end of the spectrum, the disparities in access.
Okay, great. Thank you so much, Stephanie. And for our last question, because unfortunately it's 2 o'clock, I just wanted to note that we did get a lot of questions from many different people regarding why the findings are what they are, with many different hypotheses from some of you. And I just wanted to note that from our findings in our Disparate Access paper, we cannot determine causation, but we do address some of our hypotheses within the Understanding the Data section in the report. And Stephanie and Giannina and Carol highlighted many of these possibilities earlier within their presentations as well. So we do just want to point you to check out our report as well as the state-by-state findings, which you can find at the link here, as well as reach out to us. Our email addresses are here as well. So at this time, I just wanted to say thank you so much to our presenters, Giannina and Carol, for being with us today and for sharing your reactions to our report as well as your state stories, which were very important. And thank you again to all of you for joining us today. Just a reminder that the recording of the webinar will be made available on our website, clasp.org, within the coming days. So take a look there. Thank you again and have a great day.
Thank you.